Namaskar, I am Dr. Anil Taneja. Today I will talk on heart attack. What are its symptoms? If it happens, what should we do? There are many types of heart diseases, but when we commonly say that somebody is having heart disease, we simply understand as it is a coronary heart disease or heart attack, which means there is some blockage in the arteries supplying blood to the heart. As the age advances, there is gradual deposition of the fats in the arteries, which leads to the blockage. This deposited fat is called plaque. The other component of the plaque are proteins, calcium, and fats. The symptoms depend upon how fast the blockage sets in and how severe the blockage is. Usually it presents in two forms, angina and myocardial infarction or heart attack. In angina, the blockage gradually increases, thereby reducing the supply of blood to the heart. When some patient walks very briskly, he runs or does some strenuous exercise, or he is climbing the stairs, he may get the symptoms. He may get pain or heaviness in the center of the chest. It may be in the arms, it may be in the neck or jaw or shoulders. It may radiate to any of these things. When the patient stops the activity, he takes the rest, the pain subsides. Sometimes just by keeping a tablet of sorbitate in the mouth, it subsides, or sometimes taking the spray of the nitroglycerin, that also subsides the pain. This pain may aggravate just by taking a very heavy meal, or sometimes by the sudden gross variations in the temperatures, or sometimes some emotional upset, maybe a bout of anger. These all precipitate this thing. When pain persists at rest and doesn't subside with sublingual tablets, we normally call it unstable angina, and this has to be treated just like heart attack. Now we come to heart attack or myocardial infarction. Sometimes when the plaque is too big to cause complete blockage of the vessel, thereby disrupting the supply of blood to the heart, we call it heart attack or myocardial infarction. Sometimes the plaque is small, but it ruptures. Then the platelets of the blood, they start accumulating over the ruptured area, making a clot that gradually increases and blocks the lumen completely, thereby resulting in the heart attack. Heart attacks in the young people, usually they happen like this. The commonest symptom is chest pain. It is severe chest pain, usually in the middle of the chest. It is constrictive type or squeezing type or a pressure type. It tightens the chest. It can go to neck, jaw, shoulders, or any arms. There can be sweating or cold sweats. There is gross sense of feeling weakness. There may be fainting, dizziness or lightheadedness. There can be palpitations or feeling as if the heart is stopping. There can be breathlessness. There may be restlessness. Sometimes there is burning or heaviness in the upper abdomen and in the middle of the chest. There may be nausea or vomiting. That is why many a times diagnosis is misled, presuming it to be a gas problem or dyspepsia. So we need to be very careful about it. In women, the pain is usually in the upper back, jaw or neck. Usually there is unexplained weakness, feeling of not being well. In diabetes, the symptoms may be further different. There may be just mild chest pain, or sometimes there's absolutely no symptoms. This we call as a silent heart attack. But the recognition of the symptoms of the heart attack is very important because it needs immediate treatment. If the treatment is not given in time, it can lead to permanent damage to the heart. The first hour after the attack is considered very important. If the treatment is given during this period, we can save the muscles of the heart from being damaged. That is why this is called a golden hour, and we say time is muscle. Even if the treatment is given to the patient within 6 hours, still much can be saved. But as more and more time elapsed, the chances of permanent damage to the heart, they increase. So as one sees such symptoms, one must immediately try to reach the emergency hospital or the nearest cardiac center. Till one reaches hospital, doctors in India recommend to take a tablet of Disprin, 300 mg of clopidogrel and 80 mg of atorvastatin. In Western countries, doctors recommend to take only a tablet of aspirin. For any queries or suggestions, you can write in the comment box or at the given email ID. If you like the contents of the video, you can like or share the video. If you want to receive more such like videos, you can always subscribe the channel. May God keep everybody healthy and happy. Thanks for watching.